Hello. Thanks for coming today. I wanted to take some time and introduce to you Kristen King. Kristen King is a child psychology intern. We're fortunate enough to have her join us this past year. Kristen is a PhD candidate in clinical psychology at University of Delaware in Newark, Delaware. She graduated summa cum laude with a BA in psychology from the College of Worcester, and also has an MA degree, which she received in 2006 from the University of Delaware. She has received many scholarships and numerous honors, both for her graduate and undergraduate work. And she has been working, her research focus has been looking at children's emotional development and applied research on emotion-centered perspective, preventive intervention with Head Start and early Head Start families. Kristen has also taught academically at the graduate level at the Department of Psychology at the University of Delaware. She has published in peer-reviewed journals. She has 7 publications and presented in national academic conferences over 9 times. And I also need to add that she receives grant and research support from NIMH and NICHD, and also financial support from the University of Delaware Psychology Department. Kristen, thank you so much for coming today and agreeing to do this.
Okay. So, is the microphone picking me up? Hopefully. So today I'll be talking about parenting and young children's emotional competence, and this is an area that I did some research on when I was at the University of Delaware. So for 5 years I worked there in the Human Emotions Lab with my research mentor, Cal Izzard, and all of the research in the lab really is about early emotional development. So I chose this particular topic to present on today because I think it's very relevant to what we see in the clinic. And I also hope that it will be useful to those of you who work with adults rather than children, just to get an idea of what might have gone on in the household of some of your patients when they were children, why they might have problems now with emotion regulation. So I will start out with a general overview of emotion socialization in the family, then move on to talk about my research project with Head Start families in Delaware, and then I'll close by talking about some clinical applications, though they'll become sort of, I think, self-evident as we go along. So when I talk about emotional competence, I'm referring to emotion knowledge and emotion regulation skills. So emotion knowledge is understanding about emotions, including being able to accurately recognize and label emotions in yourself, so emotion feelings in yourself, emotion expressions on other people's faces, also understanding of emotion, situation, relationships. So if you lose a toy, you're likely to become sad. So it's actually during the preschool years that kids really first develop the ability to recognize the different emotion expressions. So preschoolers are the age that we do our research with, and it's a really kind of a rich age group because at the beginning the 3-year-olds often can only identify a happy face, and then all the other faces are sort of mushed together as unhappy or mad. And as the kids get a little bit older, they begin to distinguish, oh, that's a mad face, that's a sad face, that's a scared face. So all of that kind of learning is happening during the preschool years. And it's actually not until elementary school that kids start to understand mixed emotions, more complex emotions like shame, and emotion display rules. Emotion regulation is the ability to modulate emotion arousal. So that can include modulation of intensity, of duration, of valence. So ideally, if you can regulate your emotional arousal, you can then use the emotion adaptively. So we think of every emotion as having a function, but if you can't regulate the arousal properly, you're not going to get the outcome that you want. Emotion regulation in infants is mostly actually regulated by the caregiver. The caregiver will soothe the child and help the child regulate. But even infants can avert their gaze from something they find disturbing, and infants also seek closer proximity to their caregiver when they're upset. So those are some of the earliest types of emotion regulation that we see. By the time kids are in preschool, they're learning more self-soothing skills, and they're learning strategies like, if I'm sad, I can go to my mom to get a hug, and that will help me feel better. So they're learning more emotion regulation strategies at that point. So why does emotional competence matter? Well, it's connected very strongly with social competence, and there's a very large body of research on how emotional competence leads to social competence. So children use emotion knowledge and emotion regulations to identify social cues accurately and respond appropriately in social situations. So if a child can't tell if another child is angry or sad, their response to that child could be very incorrect. It could be inappropriate. And if a child can't help themselves from getting over-aroused and angry, they're not going to be able to have very good relations with their peers. So children learn about emotions from a lot of different sources. They learn from their culture, from teachers, from peers. But the family is really the place where young children learn the most about emotions, and it's a really rich environment for learning about emotions. So the literature reviews that have been done on this topic have really divided up the types of emotion socialization in the family into these three categories that I showed on this slide. So parents' emotion expression. Children learn a lot from observation. They watch how their parents react when they feel different emotions. So when their parents are angry, they're noticing that. When their parents are sad, they're seeing that. So they're learning emotion regulation strategies just by watching their parents. The emotion expression literature also talks about family emotion climate, and it talks about what can happen if there's too much negative emotionality in a household. So if parents are frequently expressing negative emotion, that will relate to poorer outcomes for the child, whereas high positive emotion expression in a household is apt to correlate with more positive outcomes for the children. Parents' emotion discourse with children is an interesting research topic because it varies so much across families, so much across cultures. So some families openly talk about emotions with their children, and other families really, they don't talk about them. Parents themselves in their households, they didn't learn about emotions that way, so they don't really discuss emotions very much with their children. And we do know that in households where there is more discussion, open discussion of emotion, their children do have more knowledge of emotion and better emotion regulation. And finally, parents' reactions to children's emotions. And this is the area that I'm most interested in and the area that my research focused on. So every day, children are going to experience negative emotions. They'll have something happen to them that will make them sad or make them angry. And so there's just 100 opportunities a day for the child to learn based on the response that they get when they express these emotions. So when children express negative emotions, it actually can be very painful for the adult to see. So if your child is crying, if your child is having a tantrum, that's unpleasant. So it actually can be kind of a natural reaction for a parent to want to to squash that emotion down, to make it stop, to help their child feel better right away. So distract your child from whatever's upsetting them, or say, oh no, that wasn't really a scary movie, you're a big boy, that's not really scary. So just to try to calm your child quickly and move on and help your child feel happier. But in fact, we know that those types of reactions actually don't have very good outcomes. So what happens to children that get punished for expressing their emotion or get discouraged from expressing it? What we know is that, sure, those children will start expressing their negative emotions less frequently. They won't talk about their emotions as much, and maybe their reactions on the surface won't look as dramatic, but actually they're experiencing increased emotional arousal internally. So even though on the surface it may look like, okay, they're not feeling that negative emotion anymore, they are feeling it internally, they're just not able to express it. So over time, children just develop this suppression of their emotion expression, and we know that that does not lead to good outcomes then in adulthood. So when you have the increased emotional arousal, that then leads to dysregulated behaviors. If you're too upset, you're not going to respond in a constructive way to the situation. And these types of reactions to emotions also undermine learning about emotions and undermine the development of emotion regulation skills. So some examples of non-supportive reactions that have been identified in the literature are the punitive reactions, which are actually sort of punishing the child for the feeling. So if you start crying, I'll send you to your room. Minimizing reactions, and those are trying to say, oh, it's not that bad, you're not really that sad, it's not that bad a situation, you're overreacting. And also just parental distress reactions. So again, it's aversive when your child is upset. But unfortunately, if the parent's arousal gets too high, then the parent would tend to avoid the child. And I know that I've had adult patients who have said, if my child is crying, I have to leave the room, I can't cope with that. So if you have a parent that has mental illness, it really can become difficult for them to cope with their children's negative emotions when they're having trouble even coping with their own feelings. So why are these emotions considered non-supportive? They tend to reduce emotion expression but not provide regulation strategies or methods to help deal with the problem. So all the child learns is that I can't show that feeling. The child doesn't learn what to do next time to help themselves feel better more quickly. The child doesn't learn to soothe themselves. They teach children that emotions are threatening, that that's something wrong with negative emotions. If your child, if a parent is quickly trying to distract the child from this feeling, that really does give the child the impression that something's wrong when I'm feeling this way. And as I said before, it can heighten and extend children's emotional arousal when they get these reactions from their parents, especially the punitive reactions. That just makes the children's arousal go way up. They increase arousal and distress in future situations where those same emotions will be elicited. And they undermine learning about emotions, because if you're going to try to stop that emotion as soon as possible, move on to something else, or punish your child, there really isn't time to talk about the emotion and to learn from it and see what you can make out of that situation to try to do something better next time. So supportive reactions that have been identified are emotion-focused reactions, and those are comforting reactions. So reactions aimed specifically at soothing the child, dealing with that emotion arousal, so helping the child feel better. Problem-focused reactions are more about teaching instrumental coping skills, so problem solving, so trying to fix the situation to make the negative emotion go away. And then expressive encouragement, and that's the tell me what you're feeling kind of reaction, encouraging children to express their feelings. And I actually wrote here that there are more mixed findings with that. So these are all considered the more supportive types of reactions, but with the encouragement of emotion expression, they actually find that with anger specifically, some of the literature says that too high a level of encouragement of emotion expression can actually lead to aggression. Or aggressive behaviors. So there seems to be like a happy medium with expressive encouragement when it comes to anger. You don't want to, tell your child never to express anger, but you don't want to encourage it too much. That can just get the child more riled up and aggressive. So why are these considered supportive reactions? First of all, they acknowledge the negative emotion. They validate what the child is feeling. You're not trying to deny that they're having a bad experience, and you're giving them a label for what's happening to them. So they have all this bad feeling inside, and they don't know what that is. And when you talk to them about it, it gives them a label, a way to think about what's happening to them. And this teaches children to tolerate and regulate their negative emotions. And I feel like we see adults all the time that haven't learned those distress tolerance skills yet, or haven't learned emotion regulation. And it's really something that can happen during childhood that should be happening when they're children. Supportive reactions can teach problem-solving skills, and of course this can then increase the children's self-confidence or self-efficacy if they feel like, well, next time I'm sad, I know how to go about looking for my toy so that I'll feel better. So, teaching the kids how to solve their own problems. And finally, these types of reactions help children develop understanding and acceptance of emotion. So like it or not, every day a child is going to get mad at something, they're going to get sad because of something. Life is just very frustrating, and it doesn't do any good to sort of deny negative emotions. It's better to let kids know, yeah, you feel sad, I feel sad too, I miss your dad too, or I'm also upset about that. So I just listed a few examples of the many research findings, and I think I just wanted to show here that there is a really large body of research, but every individual study tend to have kind of mixed findings. Sometimes they find things in girls but not boys, sometimes boys but not girls. Some studies have only been able to show the relations between those positive parenting practices and good outcomes. Others are more able to find negative relationships. In general, in the literature, there is more evidence about those non-supportive reactions and that those have bad outcomes than there is research support for those positive types of reactions. The emotion regulation literature is also pretty large. There's a lot of this now. Emotion regulation is a really hot topic in the research literature for children, so there's a lot of studies coming out on this. And emotion regulation is actually looked at as a mediator a lot of times, so between parenting practices and child outcomes. So when a parent does a certain thing, that increases or decreases the child's emotion regulation ability, which then in turn affects their behaviors. And you can see that in the study, the Ramsden and Hubbard 02 study. So they showed that parents that accepted their children's anger and sadness feelings, those parents had kids with better emotion regulation abilities, and then those children also had lower aggressive behaviors. The final study that I cited here is interesting because it actually was an experimental study. It was an intervention study. And this is Sophie Havighurst at University of Melbourne. She's developed a parenting program based on the idea of emotion coaching. And she was able to show that by changing parents' reactions to their children's emotions, that improves the children's emotion regulation and it lowered the children's behavior problems. And actually in 2007, she published a larger trial of this intervention that she's developed. She did a community sample of 218 children and had a waitlist control group and was really able to show that, yes, if you just change parents' reactions to children's emotions, that, in and of itself can be very, very powerful. That can have big effects on families. And what's nice about studies like that is that they allow you to show some causality, because we know that the relations here between these variables are bidirectional, which is a point that I wanted to make here. So some big limitations in this whole body of research is that most studies are correlational. You can't really show what causes what. You can only say these two variables are related. And we do believe that the relations are bidirectional. So if you have a child that temperamentally has higher negative emotionality, has lower thresholds for negative emotion expression, then that might pull for certain types of parenting. If your child is more irritable, maybe you're more likely to be a punitive parent. So to some extent, child emotionality, sort of trait emotionality, does have an effect. Although, research in general has shown that emotion regulation skills do predict outcomes above and beyond child emotionality. So they really are different constructs. Most studies do only look at mothers. There are a few with fathers and a few with siblings, and those studies do show effects. It's not like children aren't affected just as much by dads or siblings, but the research really has focused on moms. And also the vast majority of the studies were conducted with middle to upper middle class, two-parent family, Caucasian families. And that's, a very limited proportion of our population. So my own project in Delaware, I used a different population sample. I was looking at Head Start families. So these are families that have lower socioeconomic status. They had low incomes. And my sample was 85% African American, 5% Hispanic, 10% multi-ethnic. So it was a different population. And so one goal of the study was just to look at these relationships and see if they still hold in a different population. And we know that, parenting practices do differ across different cultural and subcultural groups, and some parenting practices that work in some populations are less effective in others. So I thought that was important. But also I was concerned about other important variables that are confounding variables that I didn't see in some of the research studies. So when I read about punitive reactions and minimization reactions and the negative outcomes, my immediate reaction to that was, well, what else are these parents doing? If they're saying, like, don't cry or I'll punish you, are they also scolding their kids all the time? Are they physically punishing their kids frequently? And these studies were not parceling that out. They weren't really controlling for the other parenting factors that were also happening. So I thought that was a problem with the literature. So I wanted to control for some factors that I thought might be especially important in this population. So mother depression, family chaos, so just unstable households, and also harsh parenting practices. So I wanted to include those variables. So this was my master's thesis, and it was entitled Primary Caregivers' Reactions to Preschoolers' Negative Emotions, Predicting Emotion and Social Competence in a Low-Income Ethnic Minority Sample. And I'm presenting just a portion of the data today that, that's most relevant to this discussion. And I really didn't have a good reason to propose that these reactions to children's emotions would be different in this population, so my prediction was that, yes, it'll probably be the same as in other populations. But again, I was hoping that these relationships would still hold after controlling for those other variables that I mentioned. And I also was interested in looking at mediation, looking at whether the effects of these emotion and parenting practices on children's outcomes would be through their effect on emotion regulation. So my participants were 95 caregiver child dyads from Head Start preschools in Delaware from a couple different Head Start systems, and the data was collected in the spring. And the sample had slightly more girls than boys, ages 3 to almost 6, and again, mostly African American. The Peabody Picture Vocabulary Test scores I included just to give you a sense of where this population is. So they're almost a full standard deviation below the mean in terms of their verbal abilities. So PPVT3 scores usually correlate with IQ up to like 0.8 or 0.9. It's a very good sort of estimate of cognitive ability. And again, these kids are a little bit delayed. So primary caregivers, I did not specify that they needed to be women. I did get one father, but then I didn't include them in the study. It was just one more variable to worry about, so I decided not to put them in the study. But so primary caregivers turned out to be female. 82 of them were mothers, 8 were grandmothers, and 5 were other female relatives. The ages ranged from 18 to 68. The median caregiver income was $12,000. Formal schooling the average was almost 12 years. And in this population, only 17% were married, although an additional 17% were living with a partner. So I collected data from 3 sources, from direct testing of the children, from teacher ratings, and also from parents. So the child data I got was an emotion knowledge measure. So I did an emotion expression labeling task, and it was a 12-item task. And I just looked at my data. The average score was actually 6.5. So this is not a test where everyone was getting everything right. And they were shown a face, and the script goes, "Look at his face. His face shows how he feels. How does he feel?" And it does this for every item. And there's like a little script to use. If they say something general like good or bad or mean, anything that we can't code, we prompt for another response. So tell me another word that shows how he feels. Because we're really trying to get discrete emotion terms from the kids, because it's not enough to say sad, or sorry, it's not enough to say like bad or good. We really want the emotion words themselves. We had a couple control measures for the emotion knowledge task, and that's because it's so highly related to just how verbal these kids are, what their verbal intelligence is. So we partialed out Peabody Picture Vocabulary Test scores, and also we had an inattention measure. So right after each child was tested, their tester would fill out this form saying what happened during the testing session. And some of the kids were like doing somersaults down the hallway during the testing session, and we wanted to know that happened and be able to account for that, because that obviously affects their score. So we use teacher ratings for the emotion regulation and social competence variables. And there are different ways that people go about measuring emotion regulation. I thought a teacher measure would be good because it really shows how these kids are behaving on a day-to-day basis over time. So kids have good days, kids have bad days. These teachers had known these children for months, and this really gave them a way of saying what these kids look like usually. So, an alternate way to measure emotion regulation would be like a lab task, but that only says how they're doing that particular day. So I chose the emotion regulation checklist. It's a well-established measure used frequently in research. It had good internal reliability. And it does have 2 subscales, the emotion regulation subscale and the emotion lability negativity subscale. So that first subscale was more about empathy, controlled emotional displays in different situations, self-awareness of emotions. So it was more like the positive emotional regulation stuff, whereas the other subscale was more about negative emotionality, mood lability, inflexibility. And the 2 scales correlated, I believe, about 0.5. Inversely. So they weren't it made sense to keep them separate, and most research does keep them separate. For social competence, I used the Adaptive Social Behavior Inventory. It was designed for use in this population. It had been validated in a similar population to the one that I was working with, and that gave us a pro-social variable and a disruptive variable. So those are sort of what's going on in the classroom in terms of behavior. Caregiver interviews were where we got our other data from. So reactions to children's negative emotions, I actually used the measure called the Coping with Children's Negative Emotions Scale, or the CCNES, and this has been used by the major research group that's doing the research in this area, so Fabies Eisenberg. And this measure, it has 12 little parenting scenarios, and each of them is followed by 6 possible things that you might do in those scenarios. And then you rank your likelihood of doing each of the options. So how likely am I to do this as a reaction? And it matches up to the reactions that I talked about before. So punitive, minimization, distress, and then expressive encouragement, emotion-focused, and problem-focused. Pretty good internal reliability. The distress reaction scale was a little more iffy. So I thought I should show you a sample item just to give you an idea of what this measure looked like. So this is a sample item. If my child is participating in some group activity with his friends and proceeds to make a mistake and then looks embarrassed and on the verge of tears, I would. And then it gives you a bunch of options. And if you take a moment to think about it, if you're in a situation, your kid screwed up a little bit, he's upset, he's going to start crying in front of his friends, what do you do? And what I like about this measure is I think almost all the choices are pretty plausible. I think parents could feel comfortable endorsing them, you probably would get a little bit embarrassed. Your child's about to start crying. So I think that I like the measure for that reason. And parents really did endorse all of the different scales, so they weren't just giving the problem-focused and emotion-focused responses their approval. So the options here were comfort my child and try to make him feel better. That would be the emotion-focused response. Tell my child that he is overreacting. That's the minimization. Feel uncomfortable and embarrassed myself. That's distress. Tell my child to straighten up or we'll go home right away. That's the punitive one. Encourage my child to talk about his feelings of embarrassment. That's the expressive encouragement. And tell my child that I'll help him practice so he can do better next time. And that's problem-focused. And again, they didn't have to say they'll do one or the other. They gave their ranking from 1 to 7 for every response. Other caregiver measures, the depressive emotionality variable, I didn't actually have a measure of depression in the study. It wasn't a study of psychopathology. I really framed it to the parents as a study about emotions. So I did have a measure, though, of parent emotionality, and I used the sadness, shame, anger, and interdirected hostility scales to form a composite that was my depressive emotionality measure. And for harsh and disorganized parenting, I used the Parenting Dimensions Inventory. And the slide explains how I created the variables. Let's see. So in terms of data analysis, so it turned out that the punitive and minimizing scales were correlating very highly, like 0.7. They were reacting the same way. And the same thing with the emotion-focused and problem-focused. So I ended up collapsing those scales together. And that actually is also consistent with data that on the psychometric properties of the CCNES, they really have shown that there really are only 4 factors. They really aren't able to show that there are 6 different factors. And let's see. So from the descriptive data, it looked like there was no relationship with child age or child gender, which reactions parents would give. We did show that actually parents with more education were more likely to use emotion-focused and problem-focused responses. The other thing that came out was when children had higher vocabulary scores, their parents were less likely to use the punitive and minimizing reactions. So when I did the data analysis, I used a block entry regression method so that I could partial out the variance of these confounds. And the data did show big overlaps. So there really were strong relationships between my confounding variables and the different scales of the CCNES. So in the regression, I partialed out first the caregiver depressive emotionality, then the harsh and disorganized parenting variables, and then so that third block was where all the caregiver reactions to children's negative emotions were. And the models for emotion knowledge also included age and PBBT3. So these are just the correlations, partial correlations controlling for age and vocabulary score of the different scales of the CCNES. As you can see, only one came out significant, which was disappointing, and that was expressive encouragement. But, I mean, all the relations are at least in the expected directions. But again, I was hoping to find more than that. And then in the big regression model, it actually lost significance. So it approached significance, you know, p-value was less than 0.10, but it really wasn't significant anymore. And what happened here mostly, I think, is age took out so much of the variance in the emotion knowledge score that there wasn't a lot of variance left to explain. I mean, the t-value of 10 is huge for age. So it's not totally clear what happened, but unfortunately nothing ended up significant in the final model. In terms of emotion regulation and emotion lability negativity, these are the zero-order correlations, so before I controlled for the other variables. And only 2 came out significant. So the punitive and minimizing reactions related to higher levels of child lability and negativity, and the emotion and problem-focused reactions related to lower emotional lability and negativity. So those were as expected. And there was a marginally significant finding with distress reaction. But what was interesting is when I separated by gender, because there is some research showing that these relationships are different by gender, for boys, expressive encouragement related to emotion regulation with the Pearson's correlation coefficient of 0.47, and that's huge. That's like 22% of the variance in emotion regulation scores were accounted for by parents endorsing these expressive encouragement items. So I thought that was very interesting, and I don't know why it didn't happen in girls, but it was really clear for the boys. So in the overall model predicting emotion regulation, not surprisingly based on the previous slide, there weren't significant predictors. I think it was inconsistent parenting approach significance, and that was it. When I did look at boys only, expressive encouragement was the sole predictor of children's emotion regulation ability. And this is the lability negativity regression. So As you can see, there are several significant findings here. So when there's more of this disorganized parenting, and these are the disorganized households, the parents that are not following through on discipline, that relates to higher lability and negativity. When there are fewer emotion and problem-focused reactions, that also relates to the higher lability and negativity. And then the distress reaction came out in the unexpected direction. So it's significant, it's in the wrong direction. So that's something that I really wondered about. And the same pattern that you see here on this slide was found in the disruptive behavior regression as well. The same items, or the same scales are significant. So again, disorganized parenting comes out as something that has a big effect, and also the emotion problem-focused reactions. You can note here that the delta R squared for the final block was 0.10, so 10% of the variance overall was accounted for by parents' reactions to children's negative emotions. So that was a significant proportion of the variance. So in terms of what's going on with distress reactions, no, I don't think it's good to get upset in front of your kids. I don't think that's helpful. I'm wondering if what happened is that by partialing out depressive emotions, I kind of sucked the meaning out of the distress reactions variable, essentially, because I was already controlling for moms that were experiencing a lot of shame and sadness and hostility towards themselves. So it's unclear what the variable even really means in the context of the overall regression here. I mean, it's something to look at in the future, though, because there is not as much research about the distress reactions versus the punitive and minimizing. For prosocial behavior, disappointing, nothing came out, but there was a significant sex interaction, so that I looked then by gender. And in the model for boys, expressive encouragement was the sole significant predictor of prosocial behaviors. So again, for boys, somehow when parents say, yes, express your feelings, this is doing something good. I wanted to look at mediation based on the different patterns of significant findings. I was only able to do that for one variable, and that was for the prosocial behaviors, and only in boys. I was able to show mediation, and just to clarify, I was concerned that two of the variables are teacher ratings, and so I partialed out. I controlled for lability negativity in my emotion regulation variable in order to somewhat account for the method variance issue there. It did come out if I didn't do that, but I thought it made it a stronger equation. So when the path in the bottom, that path would disappear when the upper path was included. That's what this chart is saying. So the relationship between caregiver expressive encouragement and boys' prosocial behavior was fully mediated by emotion regulation. And these are concurrent data, so it's not the best data to be doing a mediation analysis in. But I thought it was suggestive, and I thought it really worked with the rest of the research literature. I thought it was consistent. So overall, there was limited support. Emotion and problem-focused reactions were predicting lower emotion lability negativity and lower disruptive behaviors. Expressive encouragement in boys was predicting emotion regulation and prosocial behaviors. The punitive and minimizing reactions, they didn't predict anything anymore when the control variables were included. The disruptive, the inconsistent parenting variable was more strong there. And the unexpected finding for distress reactions, that I'm not sure what to make of. The scale did have the lower internal consistency. It's just unclear what happened there. Again, the effects are probably bidirectional. Some of this is what emotionality the child brings to the relationship. And also, the parenting measure obviously has limitations. It would be better to use an observational measure. Just the time and resources involved in training observers and getting them reliable made it prohibitive for a master's project to do anything except use a self-report type measure. And of course, I got a lot of assistance from the lab on this project. And Dr. Izzard is my advisor, and these are other people in the lab. And I'd also, of course, want to thank the Head Start system in Delaware because they were very, very helpful and cooperative. So in terms of clinical applications, a lot of it's pretty obvious from what you've seen that parents' emotional health really is important. So even if you're working with children, you need to also be thinking about what's going on with the parents, and think about working with the parents on their own emotion awareness, emotion regulation, and self-care. Because if parents are modeling poor emotion regulation, that's what the children are learning. And if parents are getting really distressed and aroused when their children have negative emotion expression, then they're unlikely to use the supportive responses. And also, of course, encouraging depressed parents to seek treatment is important. There's a large body of literature that's pretty discouraging about the effect of depression on parenting skills. things that you can do that are pretty easy to increase emotion discourse in families is to try to have an emotion talk time at least once a week. And that can be before bed, it can be in the car on the way home from school. Some kids that are more shy, you might want to be talking about emotions while you're doing something together, so maybe you're working on a puzzle, not making eye contact. But the point is to get the emotion words out there, help build their emotion vocabulary, let the kids know that it's okay to talk about feelings with them. And then also interactive reading of children's books dealing with emotions could be a great activity that really is a nice bonding activity for families. There is a large number of children's books these days that deal with specific emotions, and they make it easy for you to find them at the bookstores. There's usually like a special problems or special issues section within the children's area that has all the emotion books all together in a big clump, so you can pick out the ones that are best that way. And when you're doing the reading with them, you can talk about the feelings of the characters in the book. So maybe that's not so threatening if they don't want to talk about their own feelings. You can talk about the feelings of the angry bunny in the book. Also, you can teach things like perspective-taking skills by asking, what do you think that character's feeling? It's also a good chance to even practice emotion identification. So if you can look at the pictures in the book, oh, what do you think he's feeling? Based on the picture on the emotion face in the book. So emotion coaching is something that can be taught to parents. The idea of emotion coaching originally came from John Gottman and colleagues, and there are 5 steps in emotion coaching, and they are: first, become more aware of your child's emotions, especially low-intensity emotions. So it's easier to work with your child on their emotions when they're not out of control. So if your child is disappointed rather than when they're crying out of control, if your child is frustrated rather than if they're having a temper tantrum. So you have to kind of catch your child's emotions even when they're not blatantly obvious, and think of that as a time to use as a learning experience. So view your children's emotion experiences as an opportunity for intimacy and teaching. This is a chance to bond with your child, to say, I feel sad too sometimes. I'm also angry about that. And it's a time for teaching. And that's a big kind of paradigm shift for some parents. Again, these emotion experiences can be unpleasant to witness. You don't want to see your child in pain, but it's really a good opportunity to teach your kids about coping with negative emotions, because every day of their life they're going to have something that makes them upset, and they need to learn to deal with it. Listen empathically and validate the child and his or her emotion. So again, it's good to say like situations where you felt the same way that they do. You help the child use words to label their feelings. Build up their emotion vocabulary, give them a way of externalizing this mishmash of feelings that they're experiencing, and help children to find an appropriate way to solve the problem or deal with the upsetting issue. And that's the best to do at the end. So once you've already gone through the other steps, when you've already calmed the child down and got them talking about the feelings, then it's better at that point to do the problem solving, so that they're not like too upset when you're trying to help them solve the problem. So Gottman actually wrote a book in '98 that's widely available on raising an emotionally intelligent child, and Gottman details the steps of emotion coaching in this book, so it could be recommended to parents if you think that that's an issue in their family. Sophie Havikhurst has a whole intervention about emotion coaching. She calls it emotional tuning, and her steps are slightly different. I thought that they highlighted some slightly different areas, so I also included them, but she based her intervention also on the same type of emotion coaching skills that Gottman talked about. So her steps are to notice the emotion, and she says that parents should be looking at facial expressions and body language. They should be looking at the situation to help them give them clues of what their child might be feeling, and she really encourages parents to be emotion detectives, to think about how would you feel if something like this happened to you. She advises you to clarify the emotion with a question, like, when Hilda ignored you, how did you feel? To reflect the emotion back at the child. It seems like you're a bit anxious, you look a little bit worried. Then help the child locate the emotion in the body. And this is an important thing that wasn't really mentioned by Gottman. So saying, like, where in your body do you feel angry? Or do you feel hot when you're angry? I wonder if your tummy feels anxious. And just giving the children a way to understand the physical sensations that go with the emotion, and to understand that that's part of the emotional experience. And interventions that work on out-of-control emotions, like interventions dealing with anger control or control of anxiety, really do have as first steps trying to get the child to understand the feelings in their body, because when the child recognizes the physical sensations of the emotion, they can catch it sooner and react to it sooner and use strategies. So empathize with the child. It makes me feel sad when I'm not included with my friends. Again, this, lets you develop some bonding with the kids and help them feel like, oh, it happens to mommy too. And then explore is her final step. So there are other questions you could ask, or you could do some problem solving together. So she has a website, and you can actually purchase the manual for her intervention, which is a 6-session group parenting program. And it's been validated in a couple different studies, and they had some really good outcomes. Let's see. So troubleshooting. So some children in these studies, it turned out that their difficult behaviors actually escalated when their parents were using the emotion coaching, or they shut down and wouldn't talk. So what they did was they looked at the tapes of what was going on in these households, because they had the families audio taping their discussions about emotions. And what was happening in most of these families is, number one, the parents were asking, why are you feeling that way, to their preschoolers. And anytime you ask a preschooler a why question, you're going to get maybe a nonsensical kind of answer. They don't know why they're feeling that way. That's too open-ended a question. It's just too challenging for the kids, and they'll shut down. So it's better to make more leading type of comments or less challenging type of comments. Making comments about emotions that made the child feel guilty or sad was another thing they saw frequently. You know, can't you see you're making me sad? You're making your sister angry. Why are you making your sister angry? So they were using the emotion words like they were supposed to be, but they weren't talking about the children's emotions. And I mean, I even saw this when I was teaching emotion coaching to preschool teachers. I saw several times teachers doing the whole, it makes me really sad when you won't sit down in circle time, and they consider this, you know, using emotion words. But this is just raising the kids' negative emotional arousal. It's making it not a very fun experience. It's making it unpleasant for them, and that's not going to be a good environment for them to learn about emotions in. And finally, sometimes the kids were the parents were trying to problem solve with the children before they had got the emotion arousal regulated. So it is important to think of that problem solving step as the last step after you've already soothed your child. And that's it. Thank you. So I guess I'm taking questions. It's hard to see. Yes.
Are there any investigations of the validity of parental self-reports?
That's always a important question. For this particular measure of parenting, I wasn't able to find any studies that were comparing what was actually going on in the household to the report. So it actually might be better to consider the parenting measure I used as more of a measure of attitudes toward parenting, because the accuracy of the report is, questionable, but I think that even makes it more powerful that just their attitudes toward emotions in their kids is also relating to all these different outcomes. And yeah, I mean, obviously it would be preferable to use a more observational measure to see what's really going on in these families, but for my study, it just had practical problems.
Don't they often measure the parents' concern with self-presentation?
Right, so there was actually a study that looked at CCNS, the scores on that measure that I used, and also presented a scale that was all about seeing if people were trying to make themselves look better. And they found that the scores on that measure only correlated with the distress reaction scale. So the other scales weren't relating to that desirability factor. So it doesn't seem to be a problem with this measure. Dr. Kumar?
Yeah, thank you for your presentation. That was really great. Thank you for doing it. I have a question. Like, I mean, you're talking mostly about young kids.
Right.
Do you have some thoughts, if you can tell us a little bit about adolescents and parents? Are there any implications of your study? And
I mean, I know there is literature out there. I was very much focused on the preschooler and young child literature, and I don't know the literature well enough that I want to make a comment that's incorrect about that, but obviously it becomes, just as important to keep that bond strong with your children during adolescence, because, I mean, again, they need to be expressing the emotions, and that emotion suppression that's kind of instinctive to parents. When you want your child to stop crying or stop screaming, it ends up having the negative outcomes in adulthood. So. I can't really see.
Yes. You know how on airplanes they say if you're traveling with a young one that you should, put on your own oxygen mask before you try to do theirs?
Yes.
Well, I hear studies of it's generally mothers, as you said, depressed mothers, children tend to show symptoms of depression. How can you, maybe this wasn't your point, how can you help I'll just use a mother, help her child if she's not receiving any kind of help for her depression, whether it be medication, cognitive therapy? Can you talk about that a little?
Right, and I feel like that's really common as well. I mean, I've actually said to several parents that very metaphor about, when you're on a plane and they say about the oxygen masks, I mean, I've said that before to moms because I think it's very, very true that trying to get the parents into treatment is really important. But I think that maybe emotion coaching is a way to sort of non-threateningly bring up the whole issue of emotions being very important and expression of emotions being important and tolerating affect being important. So you might be able to kind of educate them about their own emotions while really focusing on the kids and talking about, you know, how it's important to be able to sit with your emotion, you know, even if it's something that feels uncomfortable, just to sit with it for a while until it is able to go away on its own. But usually I just really encourage the parents to see if they can get into treatment also. Yeah. Yes?
You mentioned that this was not a psychopathology study, but did you measure aspects of either dysthymia, anxiety, or temperament for the children?
Let's see. In this study, no. We only had the ASBI, which is only looking at prosocial and disruptive behaviors. So other research in our lab has looked a lot into that, and you know, it's definitely both internalizing and externalizing behaviors in the kids do relate to their emotion regulation and emotion knowledge, but I didn't look at that in this study. Yes?
Given the population, were you able to, did you at all consider or at any point look to see kind of a majority type of parenting style that was present?
Well, I do remember what came out in this data, and that was the most commonly endorsed responses were the problem-focused and emotion-focused, and again, that also increased with parental education. So the parents, even in this sample that had more education, were more likely to do that. The second most frequently endorsed, or the next most frequently, was the encouraging the children to express their emotions. And then in the middle were the punitive and minimization, and distress reactions were actually near the bottom. The mean for that was like 2.8, and that's on a scale of 1 to 7.